Tonight on Insight, pulling teeth.
Straight up my big back teeth, roots and all.
You took them out yourself?
Yeah, by hand, just bang.
I heard the crack and the pain, it just shot up. And it was indescribable, the pain. And I pulled this out.
You tend to do more extractions rather than trying to save the teeth.
No government has ever put total dental care on Medicare.
When I woke up, I was actually in intensive care because I had really bad infection and they had to put a drain in my neck through to the gum.
Teeth, and with dental costs rising faster than the CPI, some people are now finding it cheaper to get their teeth fixed overseas. Here's Anne Worthington.
But you can see there again, I'm not smiling.
When Graham Taylor got married, there was no way he'd flash the camera a smile.
Well, smiling, but certainly with a closed mouth.
Just me doing all the smiling.
Obviously very self-conscious about it even, but no smiling again. Well, you didn't marry me for my teeth, did you?
Last year, he found an article in the paper about Australians travelling abroad for cheaper dental work. He decided to look into it.
Look, I think, honestly, if you do your due diligence and you investigate as much as you can about the clinic, if at all possible, go and actually see the clinic for yourself. Don't just book a ticket and go over there and, you know, expect to get a great job done. I think if you do your homework, then I think the risk is obviously a lot less.
Good luck.
See you, mate.
A year later, and Graham is a seasoned traveller. So where does he go? Thailand, the country marketed as the land of smiles. Dental tourism is booming in Thailand, with dozens of clinics offering cheaper dental work to foreigners. This is the fourth time Graham has travelled to this Bangkok clinic for dental treatment.
Hi, Dr. Lily. How are you? Sawadika. How are you?
Nice to meet you again.
Nice to see you.
Okay, we're going to do a lot of work today.
The clinic is totally catered to travellers' tastes, and although not registered under her name, Dr. Lily is the front woman for the business.
So this is the...
She's been in trouble with Thai dental authorities for over-promotion, but Dr. Lily has no shortage of patience as she cashes in on the Western desire for perfect teeth. How many Australians have you treated?
It's about 1,000 Australian have been treated with our centre during the past 7 years.
Graham has been treated by several dentists in this clinic, and today he's having the final touches put in place. All up, he's spent $10,000.
So this is just a picture of how my teeth used to look, and you can see the incisors were very long. The front two teeth were chipped and quite uneven. There's a large gap there, and there's gaps here as well, and quite discoloured as well, so quite yellow and just very unattractive looking. And this was the teeth after the treatment.
Wow.
Which is really night and day. This is a bridge just in the centre, so they've had to widen the gap here and then put the bridge in, and then we've got veneers and crowns. All the gaps have been filled, and everything's been pared back and it's all been evened off. So now it's almost a perfect smile.
He's happy with his new smile, and he's smiling even harder about the savings.
I've probably saved, I would say about $30,000. With the work that I've had up to now, it probably would have cost me here about $35,000 to $40,000.
Well, Lisa, unfortunately, your husband Graham couldn't be here tonight, but I understand your 6-year-old son Campbell's having a few dental problems. Will you send him to Thailand as well?
Yeah, I probably would. I mean, he obviously had to have something done quite urgently. He had one tooth, a root canal done because he had a huge abscess in his cheek, so I obviously couldn't wait for that. But if I'd obviously have to check because he's got to have a general anaesthetic. I'd be quite happy to send him over there as well.
And how did you find out about going away to get it done rather than getting it done here?
Well, we'd lived overseas for a while. We'd had lots of friends who'd gone over to Thailand for other things besides just dental, so we were quite open to the idea. And Graham's always pretty thorough and he does his research. So he's always wanted to have it done, and that way he could afford.
Carolyn Crossman, you're from Queensland. You went to the Philippines to get work done on your teeth. Why and what happened?
I went, Jenny, because I didn't find it affordable for the work to be done here. I was quite happy with what had happened. I was there for a period of 3 weeks where I had a holiday in between the preliminary work and the final work, and everything was lovely. My smile looked great when the dentist finished, and after being home for a matter of weeks, 6 to 8 weeks in fact, one of my teeth snapped.
One of the teeth that had been treated?
Yes.
And then you had other problems after that, didn't you?
I had another one snap a matter of a month later. Fortunately, I'd chosen to actually go to my local dentist in Caloundra at the time, rather than go back to the Philippines for the work to be done.
How much does it cost you to get your teeth fixed up after going to the Philippines?
I spent $3,300 for extensive work. All of my teeth are veneered, and that included 2 bridges, top and bottom. So that was $3,300, and the work that I had done here amounted to about $2,200.
So would you go away again to get your teeth done?
I would recommend that people look into it.
Even after having those problems?
Yes, yeah, I think so.
Eli Schwartz, you've looked at international dental systems and the way that they operate. How does the quality of dentistry in some other countries, in Thailand, in the Philippines, stack up against Australia? And why is it so much cheaper over there?
Well, the countries are much cheaper in general. I mean, groceries and so on. I mean, it's just a much cheaper country to go to, and I think that it's very difficult to make these comparisons simply because, as you saw in this film before, this clinic is set up purely for foreigners. It's not actually catering for Thai people at all.
People.
And obviously they would pay much less even. I mean, it's just that the whole cost level is much smaller in Thailand.
But how does the quality stack up?
Well, with these dentists, I mean, she might even have been educated in Australia. I mean, who knows? We train a lot of dentists from the Southeastern Asian countries who are going back to their countries and working there. But I think that that's really not the issue. I think where would you go? I mean, where would you go and complain? What are the complaint systems
in those countries?
In Australia, I mean, we have. I mean, it could happen obviously in Australia as well. But at least you have a dental board you can go and complain. So you have a dental association. You have a court system that you know of. And I just, even though medical tourism is becoming very very prevalent all over the world, I think there is an enormous amount of risk just doing it without knowing what's come out.
John Matthews, why is it so expensive to go to the dentist here? I mean, we've got these figures from the Institute of Health and Welfare that say that 1/3 of Australians say cost is stopping them from going for regular checkups and from going to the dentist, and people nodding their heads all over here. Why does it cost so much?
Well, I think for a lot of Australians to find $150 or $200 to get something done is expensive and difficult. But dentistry is an expensive service to provide.
I'd like to know where most people have the $200. If you're on a pension, you only get $253 a week. By the time you take your rent and food out of it, you haven't got $200 to go and see a dentist.
Anyone else
they'll delay it.
Anyone else like to say something? Lady up here.
I just feel it should be included on our Medicare, that's all. I just feel general dental fillings and cleaning should be included on our Medicare. There's a lot of people out there that can't afford it. I mean, it's so sad.
John Matthews, doctors have schedule fees. Is there such a thing for dentists? Is there a standard fee that a dentist is supposed to charge?
And under current competition law, we couldn't dictate fees. It would be against the law. And doctors
you could recommend them, couldn't you?
No, not even that.
You can't suggest a standard fee?
Well, what we do is we survey all our members and we find out what their average fees are and we publish them.
But a dentist then can effectively charge whatever they like?
Yes.
Hans Zollner, are we paying for high standards?
Well, I think possibly. I mean, I think one of the problems that we have in Australia is that it's not entirely clear what our standards are. We don't actually have like national standards for diagnosis, national standards for treatment planning. If you go to 10 dentists, you'll get 10 different treatment plans ranging from relatively non-invasive treatment plans to really quite invasive and expensive treatment plans. Now, somewhere in there must be an optimal treatment plan, you would like to think, but we have no national guidelines for this. And that would have been one of the advantages of Medicare. It would have helped to establish some sort of guidelines for dentists to work within.